The division of biomaterials and microbiological technologies has a rather short history. I established it in 2007, but our research into biomaterials dates back to the 1990s when we started to work on polymers for biomedical applications. Our collaboration with medical doctors has played an important role in these investigations. 1/3 of all patients in surgical units suffer from abdominal hernias. Surgery is their only effective treatment. In the 1980s, a polypropylene mesh was used for hernia treatments for the first time by Professor Lichtenstein in Los Angeles. This was a breakthrough in the treatment of hernias. Thanks to laparoscopic techniques, the patients feel less post-surgical pain, they recover faster, and they return to work sooner as well. However, problems with inserting and fastening the mesh via laparoscopic technique resulted in fewer and fewer surgical units using this method. As a result, this idea came to mind: to replace the mesh with a liquid that could be administered easily to the site of the hernia. It was with this idea in mind that I turned to Professor Mirosława Elfrey.
Z tym pomysłem poszedłem do pani profesor Mirosławy Elfrey.
Dr. Labib Zaire explained his concept, but he was missing the appropriate material. We started to think about how to solve this problem from a chemistry point of view.
W związku z tym, jako chemicy, zaczęliśmy się zastanawiać, jak zmierzyć się z tym problemem. Udało się to w dużym stopniu dzięki temu, że...
And when the concept was ready, we applied for a research grant, and after receiving the financial support, we began intense research into developing the new materials.
Rozpoczęliśmy bardzo intensywne prace eksperymentalne nad opracowaniem nowego materiału.
After analyzing the problem, we proposed and developed an advanced photo-cross-linking material that can be administered using minimally invasive videoscopic surgical techniques. Once inside the body, it transforms from liquid into an elastic solid that has the desired properties. Because the initial form of the material is liquid, it gives us the possibility to incorporate diverse fillers, for example, antibiotics or porogens, which enhance functionality in a given application, or tailor the material for use in a different application. The whole process, from introducing the material into the body using a minimally invasive technique to the transition to solid form, can be readily controlled with respect to space and time, allowing us to easily mend the tissue defects. The material is derived from fatty acids contained in plant oils. Depending on the specification, it may contain up to 80% renewable carbon. It is produced in a simple 1- or 2-step organic synthesis under mild conditions. The materials are relatively resistant to enzymatic and hydrolytic degradation under simulated biological conditions, and they have proved to be resistant to degradation in vivo. The biodegradation can be enhanced or decreased by tailoring the chemical structure of the material. For example, if a fast-degrading filler is introduced into the bulk, porous structure forms in time. The material has a honey-like consistency. It can be administered via a narrow channel, and it can be given any desired shape or form. Curing takes place upon irradiation with low-intensity ultraviolet light. This light is completely safe to the organism. We have carried out in vitro cytocompatibility studies of these new biomaterials. Their presence did not affect the morphology nor quantity of cells. In vivo studies into the biofunctionality of these biomaterials have also been carried out. These studies were performed in a rabbit model. The animals had hernias created artificially, and then we attempted to fix the tissue defect using our new method and biomaterial. The tests were a success. The tissue defects were fixed with no inflammatory or allergic response. Further, histological studies indicated normal cell proliferation at the procedure site.
W tym miejscu też chciałabym
I would like to
podkreślić
underscore
ogromną
the important
rolę
role of
współpracy
interdisciplinary
w
collaboration
interdyscyplinarnym
with colleagues
zespole
from
przy
different
tak
departments,
powiem
because
skomplikowanych
such
projektach,
complex
dlatego
research
że
requires knowledge
wymagają one
of not
zawsze
only
wiedzy nie
chemistry,
tylko
but
chemicznej,
also
ale też
biology,
medycznej,
medicine,
biologicznej.
and materials.
I tutaj też
We have an especially fruitful
była to
collaboration
współpraca
with
z
Professor
naszymi
Jacek
kolegami
Sośnicki
z
from our
uczelni,
university
w
and our
szczególności z
international
panem
collaborator,
doktorem
Professor
habilitowanym
Joachim
Jackiem
Kohn
Sośnickim,
from the
ale
New
też i
Jersey Center
kolegami
for Biomaterials.
z zagranicznych uczelni, w szczególności z New Jersey Center for Biomaterials z profesorem Joachimem Kohnem. Chciałabym powiedzieć, że
Finally,
opracowany
I
przez
would
nas
like to point out that
wynalazek
while
został
our invention
przetestowany
was developed for a specific
pod
medical
kątem
application,
bardzo
the
konkretnego
potential
zastosowania
of our new
medycznego.
materials is much greater,
Natomiast
given their
biorąc
chemical
pod
structure,
uwagę skład
properties,
chemiczny,
biodegradation,
biorąc pod
and easy
uwagę
handling and shaping at
właściwości,
the application site.
możliwości
They can be
degradacji
suitable
tego
for packaging
materiału,
applications,
biorąc pod
as well
uwagę
as
jego
other
łatwość
biomedical
formowania
applications,
w miejscu,
especially
w
regenerative
którym jest on
medicine and tissue
aplikowany.
engineering.
Może on być stosowany też i w innych technikach, w innych zastosowaniach, chociażby w przemyśle powłokowym, opakowaniowym, ale też dużą przyszłość dla tego materiału widzę w innych zastosowaniach medycznych, zwłaszcza w obszarze medycyny regeneracyjnej i inżynierii tkankowej.